want to share this story for those of you who don't know it, is that Robin was mentioning Dr. Harvitt, who's an expert in occupational environmental medicine, and has been helping on-call helping people down here. He's also done a curbside consult. If you haven't seen it, you can go to sciencecorps.org and look at that. But he spoke with the Navy. The Navy called him pretty much right away and said, we do training exercises over the Gulf. And sometimes, you know, somebody goes down and they're in the water, and we want to know exactly how bad this is. I mean, we want to know if we should consider suspending our training. And after talking with Dr. Harvitt, the Navy actually did suspend its training exercises over the Gulf. So that ought to tell you, you know, that maybe it's not, you know, we're getting contradictory information, which is also incredibly annoying. The public face says one thing, and behind the scenes there's an entire another thing going on. So I just want to go over what I found to be the common, well, what I'm calling the symptoms that I've heard repeated since May 5th, when I got down to Venice and asked people about what happened to Exxon Valdez, and people volunteered some of the symptoms that the fishermen were having. This is May 5th, so it was pretty much still, you know, fishermen working. And exactly identical to what people were saying. The headaches, the dizziness, the nausea, to the point where people actually burst into tears, the doctor saying, while short-term complaints, skin irritation, nausea, dizziness, pulmonary symptoms may be the initial signs of exposure and toxicity, the more serious long-term effects must be prevented. He recommended pulling cleanup crews off the beaches and out of Prisoner Sound to avoid further tragedy in the form of human suffering, illness, and disease. Those cleanup crews were not pulled out, and they weren't, you know, they weren't pulled out down here either. So the symptoms, pretty much, and I've been as far west as Seadrift, Texas, and as far east and south as Everglades City. And the symptoms kind of are between Terrebonne Parish and just to the east of Apalachicola. So it's respiratory problems, upper respiratory problems, headaches, dizziness, sore throats, hoarseness, ear and nose bleeds, skin rashes, upset stomach kind of a thing going on. And if you look at the material safety data sheet, not the one that BP has posted, okay, that emphasizes weathered oil, sweet Louisiana crude, but the material safety data sheets for the routes of exposure are inhalation and skin contact, and those are exactly the symptoms that are associated with crude oil. We were also told in Exxon Valdez, oh, don't worry, the volatile organic compounds are all going to evaporate. There's different sectors of the population where people can be more at risk than others. Like we learned in toxicology, dose plus host makes the poison. So if you're a little kid and you're down here and the waves are breaking and you're breathing more of the sea mist, you know, or you're definitely breathing it faster. As a little child, you're breathing faster. And you weigh less. So you know how child medicine is not the same dose as adult medicine, right? It's because you have littler bodies. So if you're getting the same dose as an adult, the little children are probably going to get sicker first. And then there's pregnant. And these are not only in residents, but also in visitors who have come down, and whether they spend like a week, they've been getting these same symptoms: peeling palms, peeling feet. These symptoms don't seem to be going away very quickly. So the medical doctors, and this is speaking in general, okay, coming from Louisiana this way, generally there's been this initial diagnosis, oh, food poisoning, heat stroke, staph infections, scabies. And the thing is, let's take the food poisoning and heat stroke first. I mean, I've literally talked to workers, say, that were first diagnosed, who are treated with antibiotics, and they're on like their third or fourth round. and it is not clearing up. Chemical illnesses, our bodies only have so many ways to say we're sick. So, cold and flu-like symptoms, headaches, these are all common things, but they could indicate a very uncommon causation, which is the chemical illness. The scabies and the staph infections, including things like MRSA, the flesh-eating bacteria, again, these are not being responding to antibiotics. The people who were sent home have children. They have, families. I have never heard in the 5 months I've been down here of one case where it transferred. Scabies is highly contagious. MRSA is highly contagious. It's not active. Strep throat, this is another one when all the kids came back to school. A lot of them were sent home with strep throat. And it's blistering in the nose and blistering in the mouth. These symptoms can mimic, if everybody turned purple because they got chemically exposed, then it'd be easy to diagnose. But it's not like that. And I've had people from Walgreens and CVS pharmacies and now Winn-Dixie all saying, hey, we're seeing an increase in it's a table that kind of gives you some main symptoms, whether they're chronic or acute, means whether they're short-term or whether they develop over the long term, and what you might expect that from. And it includes corrective solvents and also the oil. The problem is, if this stuff is misdiagnosed, this is what happened with Exxon Valdez. People were told they had a cold, a flu, and take Tylenol, to the point where the whole West Coast ran out of Tylenol. And I'm still dealing with people who thought they had the Valdez crud in 1989, and they thought, 14 years, 20 years, isn't this a little long for a cold or a flu? And the longer you leave this stuff in your body, the more kind of havoc it can wreak. So it's really a matter of finding appropriate medical treatment, getting properly diagnosed, and getting properly treated. But you have to educate the unhealth people, and what I would like to see is that health survey that's out there, it's also posted online on rikiott.com, and we just got it going this week, so it'll be in Vietnamese, in Spanish. We're not going to leave anybody out. You can fill it out online. You can fill it out in paper. There's a place where to send it to. The idea is to make information public so that we can see the data and start to understand what happened to us so that we can figure out what to do. So the idea is to try to get as many people filling that out as possible before the end of this year so we can get it posted without the names. Okay, so it's just going to be, you'll see for yourself. We'll analyze it too, but we're going to post the raw data so you can see what are the symptoms, what are the most common of those symptoms, and how prevalent are they across the Gulf. And not only across the Gulf, but there's a community-based epidemiology study. When I say community-based, I mean the Gulf community. So this would be going in different states, and it would be going with doctors. The idea is to sit in your community and figure out how you want to tackle your health. Long-term health, short-term diagnoses and treatment, long-term monitoring. How do you as a community want to tackle that? And so bring in your medical doctors. Talk to the other communities. Let's do it as a people and not leave it all up to the federal government, because I think that's a really bad idea.